Good morning, everyone. My name is Betsy Davis, and I'm the Assistant Director of the Child and Family Studies Department at USF. As we kind of get started, if everyone can mute their mic who isn't speaking, I would appreciate that. And we may have some more people coming in, and as they come in, that's fine. Like I said, we're recording, and we'll send out the recording along with anything else that comes up during the session in the next couple of days. So I'm so happy that all of you are joining us today. I think that this is one of our really special programs. So today I hope that you get a sense of the application process, a little bit more about the profession, and get to know what makes our students and faculty here so happy. At the conclusion of the presentation, we will have time for questions and answers. If a question pops into your head during the presentation, feel free to type it in the chat bar, and we'll address it at the end of the session. Next slide, please. Okay.
It looks like we've lost the PowerPoint. Do you want to re-share that?
Okay, wonderful. And so without further ado, I'd like to turn it over to Dr. Henry for introductions. And thank you again for being here. And I hope that this is a helpful presentation for you.
All right. Well, welcome. We are to have you here and to have an opportunity to just share a little about our program, about who we are. My name is Dr. Henry. I am the program director. I've been here at USF for about 11 years. And I've been working in the field of marriage and family therapy for about 17 years. I've worked in both private agency work as well as private practice, which I'm still currently doing. In the program, I teach the clinical courses, some of the basic skills courses, as well as the internship or field experience courses. So if you get into the program, I'll be definitely working with you on developing those skills that you'll need to work with couples and families. I'm going to turn the time over to Dr. Baxley to introduce herself.
Hello, everybody. I'm Dr. Lauren Baxley, and I am a clinical instructor in our program as well as the field placement coordinator. So my role will be involved in teaching some of the practicum courses as well as some of the elective courses. And in addition to that, my role as a field placement coordinator is going to be really involved in helping the students to find their field placement sites in the community. So I've been in the field for about 12 years, and prior to coming on board here at USF, I was working at the Tampa VA Hospital as a marriage and family therapist and helping to develop their family therapy program over there. So it was a wonderful experience, but I'm really happy to be here working with students. And I think maybe we can turn it over to Dr. Buckles.
She may not be on yet, so let's turn it over to Terry, and then we'll have Shannon introduce herself.
Terry, I think you're muted.
Thank you, and sorry about that. My name is Terry McKay, and I'm the program assistant. I've been with USF. I graduated from USF. I'm a USF grad, and I've worked with the program for about 2.5 years. I provide support and assistance to the faculty, to the students, and to you all, the prospective students. So I'll be happy to help you with the application process, answer any questions you have about the program. So I look forward to working with you. Thank you.
Shannon, let's hear from you.
Hey everyone, my name is Shannon Heller. I am honored to be the student representative for the first MFT cohort. I am in my first semester. This is a career change for me. I was previously, for the past 20 years, as a project manager at construction. while I loved my years in construction, in the last couple of years, just felt like I could make a difference. I received a bachelor's in psychology from University of Florida and was given an opportunity to leave a career and start my dream career. So that led me to USF.
Great, thank you. So we're really excited. I mean, the group of people you've just met are huge part of what makes this program great. And so I encourage you, as you're going through the process of applying, Terry is a encyclopedia of knowledge on what to do and where to go, and Shannon can give you that bird's eye view from a student's perspective of what the program's like. So they're both great resources. All right, next slide, Terry. All right, so this is the agenda for our meeting today. Our hope in today's information session is to be very informative for you, but also to provide kind of a vision or a picture of what your career could look like and what your time in the program will look like as a student. Next slide. So I wanted to start with just kind of backing out of our program and just talking about the MFT profession. I know most of you are coming into or looking at counseling programs because you want to make a difference in people's lives. And that's kind of what's led you into this. And so I wanted to just share how marriage and family therapists make a difference in people's lives. The unique thing about marriage and family therapists is not only do they work with the individual and what's happening internally for that individual, but they also are working with the relationship. Somebody is yeah, there you go, thank you. But they're also working with the relationship between that individual and their significant others, whether that's their family members, their romantic partners, and those relationships that you're helping to transform are really what provide great joy, comfort, nurturing through the difficulties of life. And so as a marriage and family therapist, your real way of making a difference is helping people have the best relationships and know how to repair and heal relationships that get stuck and damaged. So that's the profession. Now, not all your work is going to be successful. Like in any profession, you're not always going to be successful in helping couples meet their goals or families meet their goals. But when you do, you get this really sacred kind of experience of watching or being a part of this relationship transforming from the source of pain and injury to a source of healing and joy in that person's life. And there's really, in my experience, there's no career that I could have chosen that would have provided such great rewards as working with those intimate relationships and seeing them transform over time. So you are picking a career that is both challenging and difficult and can be very emotionally draining at times, but also extremely rewarding. So we're excited that you're looking into this profession. All right, next slide, Terry. All right, so our mission as a program, let's get into kind of our specific program. There's a couple points here that I want to touch on. One is that our program is to advance a systemic and a multicultural informed approach to treatment. And what that means, that systemic part really means looking at not just the individual, but outside of the individual and how the relationships and the systems that individual lives in are both influencing that person as well as that person is influencing those systems and those relationships. And so we're working with kind of the larger system, which a lot of times is the family or the relationship. And then we're also looking at people's background, their culture, their experiences, their religion, their sexuality, and how all those factors also impact the presenting problem and also the way they try to get out of their problems. The second thing I wanted to point out in this is that our focus as a program is really three-pronged. We really are focused on teaching you theory, because theory is your roadmap to knowing how to get your family or couple or individual from where they're at to where they want to go. So theory is a critical piece of what we're trying to give you during the program. And the second focus is your clinical skills, right? There's skill set that you have to develop while you're in the program that allows you to know how to work with individuals, how to work with relationships, how to work with more than one person in the room, how to manage conflict when it comes up in session. So we're going to be providing that skill set, helping you learn that skill set. And then the last focus is how do you use research to inform your practice? Our program is really developed around making sure that the clinician knows the research, knows how to find the research so that their clinical work can be informed by the research that's out there. So those are the three focuses that are part of our mission as a program. Next slide. So just a couple highlights that make our program unique and special in my eyes. The first one is that it's very specialized. You're gonna get, if you think about, some programs are very broad and they hit a lot of different topics, but they don't go very deep. Our program is more narrow, but it goes very deep. So you're gonna get a very in-depth training and theory and approach to working with families and couples. So if that sounds appealing to you, then you're in the right place, because you're going to get that kind of depth in this program. The other thing that's unique is that all of your field work or clinical practice is going to be occurring in the community, in the Tampa Bay area, which encompasses lots of areas surrounding Tampa Bay. But you'll have 12 months of working in the field, and you really get the opportunity to kind of pick your clientele and where you want to work to get the kind of experience that you want, so that you're set up to do the type of work you want to do after you graduate. Graduates from our program are also eligible for licensure in the state of Florida. We cannot guarantee licensure in every state, because every state is managed by different rules and regulations. But we have tried to set up the program to meet as many of the state, outside of Florida, many of the state requirements as we can. So if you know you're moving to another state after graduation, it'd be good to look at what the requirements are compared to our program's curriculum and make sure it's a good fit. We're also a very small, which is really nice. What that means is that we accept a cohort each year. This is only the second group of students to come through, so we're a brand new program. But because of that small cohort, the faculty get to take a much greater hand in terms of your mentoring. So each student that's accepted in the program will be given a faculty mentor to kind of help them navigate the program, but also help them navigate the program in a way that sets them up to be successful in their future careers. The program is full-time, so we are looking for students that are in a position where they can dedicate their full-time attention to the program and to moving through the program in 2 years. That is 6 semesters that will occur in. The other thing that's unique about our program is that all of our faculty who teach clinical courses have all worked or are still working in the field. So they're going to be able to bring in their clinical experience from their practice or from their work in agencies and use that in their teaching. So their clinical work enhances their teaching, and their teaching enhances the clinical work they do in the field, which is a really nice combination. Next slide. So as a marriage and family therapist and as a graduate of our program, you will be set up to work in various different settings as a clinician. Obviously, it's a terminal degree, so that means that with that degree, you can set up a private practice. after you're licensed. You can work in the VA. There's a lot of residential or in-treatment facilities that you can work at in the addictions field. There's crisis stabilization units that we also have students working through, outpatient units with both hospitals as well as treatment centers, and then in medical settings. So there's really a lot of options, a lot of variety in terms of what your career path. So if there's one population that you don't feel comfortable working with or don't like working with, there's plenty of other options in terms of how you can set up your career and where you can work after you graduate. Next slide. So in the degree, there's two tracks, there's two options. The first option is to do the general marriage and family therapy track. And I'll go in a second to what that looks like. The second option is to combine your general track with the addictions certificate. And that certificate sets you up for the state's MCAP. So when you graduate from both the program and the certificate, you're prepared to start working towards your MCAP with the state. Okay, next slide. So full-time, what does that mean? A lot of people ask that question. What does full-time look like? In our program, full-time is going to look like 5 classes in your first 2 semesters. And then after that, you will start field placement and you'll start working in the field. And so when you start working in the field, your class schedule will drop to 3 classes a semester. So that's kind of what you can expect in terms of full-time coursework. And with that, if you follow the plan of study, it's a 2-year program or 6 semesters. Starts in the fall and ends in your second summer. Next slide. So just the breakdown of what those 60 credit hours in our master's program are. 42 are core classes. 6 credits will be towards electives, which I'll show you in a second what those electives are. And then 12 credits will be towards field placement. So that combined equals your 60 credit hours total. Now with the addiction certificate being added in, it actually will equal 63 credits. You'll have 3 more credits, which if you think about it, it's like an additional elective is needed in order to fulfill the certificate requirements, which Dr. Buckles will share with you in more detail in a second. Next slide. All right, so this is an example of the plan of study that you'll be using as you go through the program. As you can see in fall 1, it's that 5 courses that I just described. And then in spring 1, also 5 classes. All those courses are really prepping you to start working in the field, which you start doing in summer. Since we have Shannon here, I thought it might be helpful for her to just share a little about her experience in her first semester in the program and in some of those clinical classes, that what her experience has been like.
Thanks, Dr. Henry. So upon entering this program, we didn't realize that the COVID was going to hit. So we've had to switch on to online. And I think that we were all a little nervous about what that was going to look like. But I can say that not only has the faculty been amazing through everything, but the knowledge that I've gained in the very short amount of time that I've been in this program is quite astonishing. I can now confidently do role plays with my partner in foundations class, and at the end of it, feel good about it. Whereas my first class, you get very nervous. You're with a partner. You're acting like you're in a therapy. Even being in the computer, it's been amazing. Like I said, the knowledge. I talk about the program all the time with my family, to the point of they probably get sick of it, but that's what you have to do. You have to live the program, right? So I would say that this program has been amazing. I can't wait to get on campus. I can't wait for my practicum next summer. I think that I feel like I'm going to be well prepared for the therapy room.
Great. Thanks, Shannon, for giving that kind of insight into your experience. So those are the classes and kind of what you can expect in terms of which semester you're going to be taking which classes. Next slide. So I just wanted to show you what the electives were. Remember, you get you get 2 electives, 6 credits worth. So you get to pick 2 of the 4 options here. The medical family therapy and integrated healthcare. If you have an interest in working in the medical field, that class is an excellent class to add to your schedule. Trauma-informed treatment for individuals, couples, and families would be a good fit for most of you, because what we've found is that most of our clients, and if you're working with a family, at least one member of the family, right, has had some kind of trauma in their history. So it's becoming a much more common issue that therapists need to be informed about how to work with. Group theories or practice. You will get some group training in other courses that are being taught in the program, but if you want more than what you're going to get in those classes and get a full class in it, then you can specialize in that and take an additional class in it. And then the other piece is that we're going to give an elective in individual and family treatment for children and adolescents. And right now there's no other program that offers a child and adolescent treatment course. And so we're really excited about that being another option for students interested in working with the younger population. Next slide. All right, is Dr. Buckles on the call? If not, I will do it for her. Dr. Buckles?
I'm here, Dr. Henry.
Okay, why don't you just introduce yourself, and then you can take the certificate on.
Okay, so I'm Dr. Buckles. I'm an instructor in the RMHC program, and I'm also the director of the Addictions and Substance Abuse Counseling Certificate, which is what I'm going to speak to today. So as part of an option for a certificate, you can take basically the addictions courses. What that involves is 5 courses. So what you're looking at is 2 of the courses are in your general track, and then it highlights, as you can see in here, the other courses that will fall in line with the certificate. So it's 5 total courses. So your practicum counts as one of those courses. It does not have to specifically be in a substance abusing providing agency. Most of the time, what you're going to find is that you're going to run into addictions regardless of what agency you're working with, and addictions can have a humongous impact on the family. So when you are working with couples or families, you would definitely potentially run across addictions and substance abuse issues being one of the core issues presenting. Also, in our counseling approaches class, which everybody takes, so that'll be one of them that counts towards the certificate, we talk a lot about addiction and the impact on the family and relationships. We look at how family systems is a evidence-based approach to the treatment of addictive disorders. So a lot of facilities are integrating family counseling into the therapeutic intervention process. You'll get to kind of learn about addictions in general and the different treatment settings, but also how integrating family into those processes is a critical treatment approach. So basically what you'll have is the professional skills in addictions counseling, fundamentals of substance abuse, and addictions treatment of special populations are the additional 3 courses. Then your practicum will count, and then the counseling approaches for substance abusers will also be in your general track that'll count towards the certificate. And if anybody's interested and has questions, please feel free to reach out and let me know. I can answer any questions that you might have regarding the field of substance abuse and addiction counseling, and how it can impact families, couples, and you may see it integrated in your future career.
Thanks, Dr. Buckles. Yeah, she's done a really beautiful job of really integrating those 2 programs, right? Combining the certificate with the master's program so that it's as seamless as possible for you. And it's a great point. These addiction treatment centers are really starting to see the value of having a family treatment component to the work that they're doing. So as you get both your marriage and family therapy master's degree and your certificate, you're really setting yourself up to fill a niche that's really needed in the field of addictions counseling. All right.
Dr. Henry, I'm sorry, just one more thing that you reminded me of. So one of the things about the addiction track, so it sets you up to become a master's level certified addictions professional. So there's a state level credential that is specific for substance abuse. And so you will be set up with this coursework to meet the 350 content specific training hours. And that's one of the reasons why the practicum can be at any site, is how the state board considers their clinical hours is any position in which the job description matches what a counselor would be doing. So basically any counseling skill, because we recognize that addictions is across a number of fields. So if you are interested, it's an additional state level credential that you could sit for and work towards after graduation. There's some clinical requirements similar to licensure and some supervision requirements. But your course content training will be done with the certificate, the 350 hours, and set you up to be able to go into the field and collect your clinical experience and your super experience in order to sit for MCAP credentialing, which would basically make you a licensed marriage and family therapist if you're looking at going licensure route. And you can also sit for what's MCAP, is what it's called, Master's Level Certified Addictions Professional. And so as Dr. Henry alluded, it gives you that niche. So with that certification along with your license really sets you up for that niche that you have and identifying you as a qualified practitioner. It doesn't set you up to just do substance abuse because you have a wide array of opportunities with your license, but it just recognizes you as somebody who's been specifically trained in not only working with families, but in understanding addictions and some of the impacts that it might have on the family. Sorry, Dr. Henry.
Oh, that's awesome. Thank you. All right, so Dr. Baxley is going to take us through field placement experience.
Great. Yes, hello. So next slide, Terry. I am really excited to talk to everybody about field placement. Typically, it's one of the most exciting parts for students is after they've done their 2 semesters in our program of that foundational coursework, doing lots of role plays, getting all of that academic book knowledge, discussion of theory, you get to put it all into practice. And so for our program, that's going to start in the 3rd semester. So that first summer is when you'll be going into the field. And so given that we're a new program, we're still in the process of developing the partnerships in the community. But I did want to mention that we are targeting agencies and practices all throughout the Tampa Bay area, from Pinellas to Polk County, Pasco County, Hillsborough County. And so we're really wanting to have opportunities for our students across the board, but also, you know, part of my enjoyment in taking on this role in the program is not only how our students are benefiting from those experiences, but also the wonderful impact that our students are able to make in our community. And so having a variety of different placement sites across the board are going to help us to meet those extra needs in our area. Some of the types of sites we're looking at, or I've been communicating with and getting onboarded, are those community agencies that are serving minority and at-risk populations, private practices, in-home therapy opportunities, medical settings, substance abuse centers, outpatient treatment centers, some inpatient treatment centers. There's just a wide range that we are looking at getting on board for our students to have their experience with. One of the really great and I think special aspects of our program is that our field experience includes 4 consecutive semesters of field work. And so what that comes out to is about 14 months in total, because it'll be starting in May, right, summer 1, all the way through the following summer. And one of the big benefits of having 4 consecutive semesters is there is no break in services where you're starting with an agency and then having to take a break because you're not enrolled in a field course the following semester, and then having to get restarted with whether it's the same agency or another agency. And so I think it's going to be, it is a wonderful benefit for our students to be able to have that consecutive experience, get established with the site, get to know how it works, the importance of it, what you're doing, really get to dig in and see clients, couples and families through a full course of treatment. I think that's that's very special, and it's different than some of the other mental health training programs. So I wanted to highlight that and point it out. The other piece is that our program is very focused on the clinical face-to-face contact. And so our requirements are based on the student over those 4 semesters, right? Accruing 350 hours of face-to-face client contact. That means direct client contact, right? So working with the clients, that doesn't include, you know, what others might term agency hours or, you know, the documentation process and all that. So we're really wanting to focus on that face-to-face client contact. And of those hours, 200 of them are going to be relational, meaning that you'll be working with families, with couples, and with relationships, which is so important in the training of a marriage and family therapist. And so I think it's important for applicants to be aware of that strong priority that we have in making sure students are actually working with clients in the field and that they're getting that relational experience. Okay. I guess on this slide too, well, actually, Terry, next slide, please. So this is our field experience map, and as you'll notice, right, it highlights the 4 semesters and they build on each other. So in that first semester, you'll be focusing on implementing and refining those foundational therapy skills that you learned in the first few semesters of your program. Then we add on that layer of theory and integrating systemic theories into your work. The next semester, we're working on enhancing those and really implementing it through a full course of treatment with the clients you're seeing. And then in that final semester, you're working on really just honing in and refining all of those skills and application of theory, and you'll complete a capstone project at the end of that, which I know Dr. Henry will talk about in just a minute. But before I turn it over to him, I also wanted to mention, I think a unique aspect of our program is that I really want to take a hands-on approach in supporting our students in finding those field sites. And the ways I want to do that is having really strong connections with our sites where, you know, I'm very familiar with how they work, who they are, what type of student is going to be a good fit for them. And at the same time, having individual meetings with our students to identify what their interests are, what's important to them in a site, and try and facilitate that matching process a little bit to really support our students and our partnering sites to develop really good supervisory relationships and just a good experience overall. So that is another, I think, beneficial and unique aspect to our program. I think that's it. I don't know if there's anything else. So yes, Dr. Henry, the capstone.
Thanks, Dr. Baxley. As you can tell just from listening here, she has a great passion for what she does and what she brings to the table. So we're very fortunate to have her on board. All right, so capstone project. Most programs, right, have a comprehensive exam, which is usually a either written or multiple choice exam that's supposed to evaluate all the information that you were supposed to have learned over the course of your program. We are moving away from a comprehensive exam model in this new program to a capstone project at the last semester of the program. And that capstone project, I'm going to be real vague about it just because I don't want to overwhelm you with the details, but just so you know, it's going to be an applied project, right? Where you're working in the field already. You're going to use one of your families or couples that you're working with to demonstrate components of all the coursework that you've done over the course of your program. So instead of sitting down for an exam, which you might have in other programs, you're going to pull together and create a capstone project that you'll be able to present with clips of your work over the course of your treatment with that family or couple. So we're excited about that because that's much more, in terms of what we're trying to get you to learn, that's much more applicable to your licensure prep and to preparing you for work in the field. All right, next slide.
So I think it's important for applicants to be aware, right, that our program will provide students with all of the required coursework and the hours, the field hours that they need to apply to the state as a MFT registered intern. And so once you have applied to the state, you've received that registered intern status, that means that you're now working towards achieving licensure. And that link at the bottom, I know that we'll be sending this recording out. That's the website you can go to learn all the details about what that licensure process looks like. But overall, you know, once you are a registered intern, it takes a minimum of 2 years where you're collecting hours and you have a supervisor that's overseeing that in the community. And so that our program will prepare you for that process.
Next slide. All right, Terry's going to take over and talk about the application process. So I'll turn the time over to Terry.
Okay, so we are currently accepting applications for the fall 2021 cohort, and we only accept students in the fall semesters only. So we have eight openings. We are expecting it to be somewhat competitive, so you're going to want to put your strongest application forward. So what you're going to want to do is complete your application and submit it by the priority deadline, which is January 15th. And those applications that we receive by that date will receive first consideration. If for some reason applications come in after that date, we can't guarantee that they will be considered. It will be based on whether or not we still have openings. So it's really important to get that application done by January 15th. So these are the things that you're going to want to complete in order to be considered. And we consider all majors. We look for a 3.0 GPA, a statistics class of a level 3000, and of course the completed application. So you go online and you upload documents. You're going to upload your resume and your personal statement. And the personal statement is about 1 to 2 pages, just about yourself. This is a good opportunity to highlight things about yourself to make you stand out, like any related research that you've done, any related job experience, and any volunteer experience. And I guess Shannon, she went through this last year. So Shannon, do you have any tips on the personal statement?
Yeah, I think it's important just to speak from your heart. You know, from my personal experiences, talk about your past experiences that have prepared you for this program, and then discuss what your future goals are and how you think that this program will help you achieve those goals. So just go into more of a personal statement of, you know, that's what it's called, personal statement. So go into more of a personal statement of what you want to get out of the program, and it's important to highlight what you've learned today and how you think that that's going to help you achieve that goal.
Thank you. Okay, then you're going to have 3 letters of recommendation submitted on your behalf. You don't actually submit those yourself. You just enter in the email addresses of your recommenders, and then once you submit that application, your recommenders are notified through email to upload the letter of recommendation on your behalf. Unfortunately, we can't accept letters that you upload yourself. Dr. Henry, can you just explain a little bit about what you're looking for in those letters of recommendation?
Yeah, so there's essentially 3 different types of letter recommendations. One is an academic letter. Those are coveted. I mean, that's what we're looking for, is academic letters that show from other faculty how you perform in the classroom and how you behave in the classroom. So those academic letters are important, and 2 of your 3 need to be academic letters. Your 3rd letter, you can do one of the other types of letters. One is a professional letter, right? If you are working in the field, it'd be great to get a letter from your supervisor stating how you do in the job that you're working in. If you're not working in the field, and even if you're not working in the field, let's say you're a waiter, waitress, have your supervisor talk about the transferable skills, right? The skills that you apply on your job that may translate into the therapy room. because any of those things we'll take into consideration. The other type of letter is just a personal letter. Those are kind of the least helpful for us, but one of your letters can be a personal reference. So remember, 2 academic letters, one ideally would be from a professional reference. And if you don't have a professional reference, then a personal reference is acceptable for that 3rd letter.
Okay, thank you. And then we do require the GRE. So what we ask that you do is go ahead and upload your unofficial GRE scores as soon as you get them, because sometimes it takes a while for them to arrive to admissions, and we want to make sure that we're able to evaluate them before January 15th. So go ahead and upload your GRE scores, your unofficials, and make sure that the official scores are sent to the school. And you're going to want to take your GRE as soon as possible if you haven't taken it yet. And then the same with the transcripts. We need to have transcripts from every higher education institute that you've attended, unless you graduated from USF, in which case we already have that, admissions has that, we can review it. So if you're from outside of USF, you're going to want to, again, have your transcripts, the official, sent to the college, but so we can evaluate them quickly, go ahead and upload the unofficial documents. And then lastly, there's 2 forms that you sign and upload, an accountability and background and drug screen form. And those are basically forms just notifying you that when it comes time for field placement, your sites may require drug screening and background investigations. And we just want you to be aware and you know that will be coming up. So, and then you're going to, of course, pay your application fee. So that will complete your application. We will start reviewing those towards the end of the year. Selected applicants will be invited in for interviews. Interviews take place January through the spring. We will make some decisions right away, and others may take a little bit longer as they're evaluated. And we'll continue that process until all of the 8 openings are filled. So that is basically the process. Now, Shannon, do you want to just explain a little bit about what your experience was and kind of what you did to prep for the interview day?
Sure. So I think on the interview day, the most important thing is to relax. This is a bit of a job interview, but you know, you're just selling your personal self, right? So it's not, you know, a test. Just go in there, be yourself. All of the faculty is super warm and welcoming. You never feel uncomfortable. My personal interview day was actually very enjoyable. They do a little icebreaker. They had a couple of student representatives there that were so incredibly kind and made me feel very comfortable with the faculty. Like myself, that I've enjoyed them. They also had nothing but incredible things to say about all the faculty. And then my last piece of advice is if you don't feel confident, go in looking confident. Even if you don't feel it, fake it. You will relax. It's not that intimidating. They're all very kind. There's no trick questions. Just go in there, be yourself, and you'll nail it.
Okay, thank you. And then the last thing I just want to say is I probably have already started communicating with many of you that are attending today. And if you've contacted me, most likely I've sent you out our welcome packet of information. If you have not received that, or if you'd like one, please just email me. My email address, and we'll put it in the chat bar, is rmhcprogramassistant@usf.edu, and I'll be happy to get you out the packet of information, which has all the instructions on what you need to do to complete your application. So for the tuition and scholarships, the in-state tuition is $431.43 per credit hour, and then out-of-state is double that. That comes to about between $25,000 and $26,000 for the full 60 credit hour program. And then we do USF, you know, we have financial aid, and you would just, if you were interested in checking into that, you would just contact the financial aid department and they will assist you. Bessie, did you want to talk to the scholarships?
Sure. I think one piece of this that I hope that you all are gleaning from it is that we really, between the faculty and the staff and the other students, everyone is rooting for you and wants you to have a fantastic experience and to take obstacles out of the way if we can. So what we have done is we pulled together a list of USF and then state and national scholarships that apply to different kinds of counseling students and MFT students. And we've set up workshops with our career services to help you put together a really strong application once you're a student. And we've actually had several students secure those scholarships. We had a student in our RMHC program get the AAMFT Minority Scholarship 2 years in a row. That's fellowship. And what's really great about that is she gets a financial benefit, but then she also gets the opportunity to be trained specifically to work with minority populations, and also a chance to network with rising stars throughout the whole country, which is really fantastic. And the AMFT scholarship committee is actually planning an information session for our students early next year. So we do what we can to try to reach out and create opportunities for you to network and make the most of your experience. So I'm really something that I feel passionate about, and we know that what you contribute to the field is going to be so great. So we do what we can to help make it possible for you.
One other thing I wanted to add about the application, and thank you, Betsy, for that information, just to back up, is that we look at the application, all the parts as a whole. So if there's one area that you feel like maybe you're not as strong on, then there should be another area that you can highlight and excel in. So that way it will even out the application. So just wanted to add that. Thank you.
Great. Thank you all. Once again, wonderful team here that we get to work with, and they've done a great job of presenting our program. So we are now at the point in the presentation where we're ready for questions. And I know a couple came in on the chat bar, so we'll just start going through those. If you feel like all of your questions have been answered, then thank you for joining us, and we look forward to hearing from you in the future. If you have any additional things later on, feel free to contact me or Betsy or Terry. So Betsy, you want to read through what questions come up?
Sure. So April, thank you for joining us. April asked, what if you can't secure 2 academic letters? I feel confident I can get 1, but I've been out of college for 5 years, so 2 may be a challenge.
Ryan, did you want to take that one?
Sure.
Dr. Henry, thank you.
So definitely get your 1 in. We understand that there are some gaps, right, in some people's education. They've gone out into the workforce and they're coming now back to school. And so make sure you get at least 1, and then in your letter of purpose, your statement of purpose, make sure you highlight or talk about why you weren't able to get a second one, and then also make sure that your other letters are strong and that they're coming from professional references, right? If you have been in the workforce for those 5 years, then we want to hear what kind of skills you possess from that job that may be applicable to the counseling profession. So make sure those other.
Okay, great, thank you. And our next question is from Yasias, and she's asked, currently majoring in psychology as a freshman, and was wondering if it is the best fit for trying to be a marriage and family therapist, because she was debating between that and sociology.
Okay. Yeah, so that's a great question, and one that you're going to have to hopefully, as you get this information, you'll be able to start narrowing it down. But I would say the kind of the different career paths are, our program is going to be clinical focus, which means you're going to be working with clients, helping them work through their problems in kind of counseling setting. Sociology is going to be more research, more maybe less individually focused treatment, right? It's not going to be clinical. So it really depends on what your career goals are. What do you see yourself 5 years from now? How do you see yourself in terms of your long-term goals? And that might help you narrow that down. Dr. Baxley, anything you'd add to that?
No, I think you summarized that well. I know it took me a while to figure out what my undergraduate degree focus was going to be, and one of the things that was most helpful was just talking with a variety of professionals in the field and just chatting with them about their backgrounds, how they decided on the careers that they chose. And I knew I wanted to be in mental health, but talking with psychologists, talking with marriage and family therapists, mental health counselors really just helped me to identify which direction I wanted to go in. So that may be helpful for you as you're trying to figure out which major to take at this point.
Okay,
Dr. Henry, can I say something about that as well?
Please.
So when I was deciding on which path, because there's several different licensures out there that you can go for, and making sure that USF was the correct program, it is helpful to go on different psychology websites in your area and look at the faculty that's in that program, and you'll be able to tell once you go into their bio, you can see what undergraduate degree they have and where they obtained that degree. It's very helpful and useful knowledge. You can see kind of the path that they took, and you start to see a pattern. So I would recommend doing that. I would recommend just doing a Google search and going to each one of those facilities' websites and checking out their faculty.
Great. And the last thing I'll say there is, this is for everybody. We don't eliminate people's application based on their undergrad degree. So regardless of what your undergrad degree is in, you can apply to the program. We're not going to say, oh, if you came from math, you're not eligible to apply for a program. So whatever your undergrad is in, don't feel like that would eliminate or prevent you from moving in a different direction for your master's degree. So anyways, great question. And if you have any other questions about that or want to talk more about it, feel free to reach out to me.
Okay, that was a really good question and good answers. The next question is from Amanda, and she asked about the program's accreditation and licensure and what that looks like now and in the future.
Great question. So because we're a new program, we are applying in the process of collecting data to apply for co-AMFT accreditation. Co-AMFT accreditation requires that you have graduated one class and collected data on that cohort of students before you apply for accreditation. So the program is in process of collecting data right now. And so we will, we've been told, our understanding is that once you submit your application, which we plan on doing after the first group graduates, it's a year from the point you apply, because they have to do a site visit and review your case, your self-study. So a year after, so 3 years from the beginning of the program, which was started in fall 2020, that's our program's goal for being accredited. And yeah, did that answer your question? Let me get clarification from whoever, is it Amanda? Did that answer your question, or did you have a second part of that?
Well, let's, I'll keep an eye on it, and then we can maybe move on to the next question. Okay. So people have been asking about if their application is complete, how they can check it, and how they'll know if there's anything missing. Terry, can you talk a little bit about that?
Yes, I have started reviewing the applications. So I will be contacting each one of you to let you know if there's any items that are missing. I think also you can create an account with USF if you don't have one already. And you can log in and you can view your application status. You can even tell if the letters of recommendation have come in. But yes, you will be, if you start an application, you will be hearing from me. But feel free to email me and ask me any specific questions that you have, or if you want an update.
Okay, that's great. And then somebody else asked about the GRE, if it's the general GRE or the psychology GRE, and it is the general GRE that we're looking for. Melissa asked about where this recording will be posted. As of now, we'll be sending it out to the emails of those who registered, and it typically takes a day or two to process for us to get the link. So we'll be sending it out definitely by the end of the week, but as soon as we can. Okay, let's see. Daniela said, if you have conducted research with a professor, can you still use them as a professional recommendation? Dr. Henry? You're on mute.
Thank you. You can use that as an academic reference. If you have been working with the faculty in their research lab, you can actually, that can count as one of your academic letters, because they can speak to your ability to work with the group, be in a research setting, your writing ability. Those are all things that academically we're also interested in. So yes, that can definitely count.
Thank you. And as far as the statistics course requirement, is it required for a student to have that before they apply, or is it possible to take that over the summer before they begin the program?
That can be done after you've been accepted to the program, before you start. Yeah, so that summer can be taken during the summer.
Okay. And then if I received a GRE waiver, will I be given an equal spot, an equal chance to secure a spot, or will students with GRE scores be given first priority? Dr. Henry.
Great question. We will not, if we give you a waiver, that means we will not hold that against you. But I will say that we are going to be pretty, that those waivers are for extreme exceptions. And so if you're writing, if you're writing a request for a waiver, make sure you provide sufficient information and details about what makes your situation unique, and that there blocks you from either taking the GRE at home, which is an option now with COVID, or taking it in person. You really have to provide us with enough detail that we understand that both those options are blocked for a specific reason. So it's going to be very few that are going to meet that, but we want to make sure that that's available if there is a situation where that is the situation, and it will not be held against you in the review.
Okay, thank you. And there was another follow-up about asking for a GRE waiver and asking if it needed to be a formal letter or a brief email. I certainly recommend doing a professional formal letter if you're requesting it, with all of the details that Dr. Henry offered. And like he said, it's probably going to be very rare to receive a waiver. And in my experience, GREs tend to only help strengthen an application. So I think you can see it as a way to boost your application as well. We have another question about the size of the cohort. Someone asked that it said that it seems 8 seems quite low, and is that correct? And do you want to speak a little bit, Dr. Henry, about the size of the cohort?
Yeah, so the cohort size, part of that is based on our accreditation standards. When you get to practicum, accreditation requires that practicum courses are no larger than 8. And so we are in the process of growing the program and hiring new faculty to join the program. And so as new faculty are hired, that cap will expand, but for now we're taking 8. Yes, it is small, so we'll be very competitive, but it will continue to get larger over the years the program exists. Dr. Huxley.
Yeah, I just wanted to mention that I'm glad you brought up, the importance, and I think it's very valuable to only have 8 students in our practicum classes. But another aspect to that too is that, and Shannon, you're part of our group of 8 right now. And I think it's really gives the best of both worlds, because we as faculty get to have a really great working relationships and know our students very well. The students get to know each other very well. And then also I think it's important to know that some of the coursework is shared with the mental health counseling program. And so there will be some classes where you are in, groups of 14 or just larger groups, not super big classes, but I don't know, maybe 14 students in those classes. So it's not always just you and 8 students. There will be some shared coursework where you're around other students in the other program, but then you also get that close-knit 8 core MFT cohort and the core MFT faculty. So I wanted to highlight that piece.
Thank you. And Amanda did have a follow-up question about the licensure. So she asked, with the accreditation, how that will affect licensure later on to become an LMFT.
So the accreditation will become, it'll be a helpful component, especially when trying to move from state to state. Most states that have licensure are going to have some statement that says have graduated from a co-MFT accredited program or have these coursework, right, and these hours. Florida is moving in the direction of requiring co-MFT or coming from a KCREP program with specific coursework. And so as we move forward, that's going to become critical to licensure in Florida. But it's also a big advantage in the future with other states because, like I said, it makes the transferring your license less hoops to jump through. You can send your transcripts from an accredited program instead of having to send all your syllabi and try to your courses match what the state's courses are. So if I'm understanding your question, it will aid in the ease of the application process for licensure. And in Florida, it's moving in a direction where that's going to be required by all programs to be accredited. So that's the direction we're moving.
And just to add to that, when Dr. Henry and others designed the master's program, they looked at the Florida licensure requirements and based the classes on those requirements. Is that a good summary of what you did?
Yes, we looked at both the state licensure as well as the accreditation standards and made sure that our courses and our curriculum was meeting both state and accreditation standards.
Great. And then Kyle asked about how students are able to create ways to make the program more affordable, as far as if any of the field placement semesters are paid, or if students work within the university. And we do have a number of students. Oh, I'm sorry, it's Jenna. Sorry. We do have a number of students who are graduate assistants who get some tuition subsidies from that. We help them find it, but I think that our students are fairly creative in how they work to pay for a full-time program. And Shannon, I don't know if you have any insights to what your peers are doing. I know whenever I ask different students, they have a number of different ways that they approach it.
Yeah, I mean, my personal situation is very different. I'm married. I'm older. My husband and I discussed how financially we were going to work this. I have children, so me personally, we have just worked that into. We just changed our lifestyle dramatically to be able to make it work. The scholarships that I've found for my personal situation, they don't come in effect until I'm in the program for a year. So I can't really speak to the scholarships because I haven't had the opportunity to try any of them. There are scholarship opportunities through AMPT, which you can look at. But yeah, I would just take a look at your situation. So if you're looking at a profession in marriage and family therapy, from my personal experience, this has been a dream. I didn't follow that dream when I was younger, and I got into a career that necessarily didn't fit me and my beliefs, right? So I've always wanted to make a difference. So I think that you really need to take a look at yourself and what you want to do long term. Yes, it's a financially, it might not be suitable, but there are ways to make it work, and it's your lifetime. I don't know how old you are, but it's 2 years out of your life, and you're going to be in this career for 20, 40, 50 years, however long. So I would really take a look at that and take that to heart, and there's ways to make it work.
Thank you. And Kyle, if you send me an email later, I'm happy to pass along our list of scholarships that we've compiled. It's a working list, but like I said, it's all over the country and different things that we've looked for. So when we send out the recording, maybe we can send that along too. And then I think this is a good question for Dr. Henry also. Jenna asked, with a strong desire to begin the RMHC program at USF and a high interest in MFT, with there being less spots available in MFT, is it something that students can join later through electives or additional credits? Or if you needed to make the choice, how does that look?
Great question. So we haven't worked out all the kinks yet in terms of interviewing, and I think where we've landed at this point is that we're going to have people that are interested in both programs, right? So they're interested in applying to the RMHC program, and they're applying to the marriage and family program, that we're going to ask for you to put your preferred program. Not saying that you eliminated being considered for the other program, but just if both programs are interested in accepting you, we need to know which program is your preferred. So I don't know if that is going to show up when we start sending out, I believe it's going to show up when we send out invitations for interviewing. When we send that invite, it will have a request to identify your preferred. And like I said, it doesn't mean that if you pick one or the other, it doesn't eliminate you from the other one. It just means that if you're accepted into your preferred, that's the one you're going to get accepted into. If you don't get accepted into your preferred, then you're always still eligible to still be accepted into your second choice. So in this scenario that you're describing, if you put MFT as preferred, RMHC is your secondary, and because of our 8 spots, they fill and you don't get a spot in the MFT, but you're a strong candidate, you will still be a strong candidate for the RMHC program. And yes, there is a MFT certificate that would allow you to still take some electives and some courses in marriage and family. Obviously not the same depth of knowledge, but definitely give you that introductory knowledge and information to get you started working with families and couples. Did that answer it?
I think so. I do think it's important to note that they are separate programs. They require separate applications. And even though some of the people like Terry and I are working with both programs, in your head, if you can separate them and go through the application process in that way. So we are not expecting a lot of people to necessarily apply for both.
And they don't have to pay the application fee twice. That's my understanding, is once you've applied to a program, you can apply to other programs without having to repay another application fee. Can you confirm that, Terry? Is that true? Am I lying?
Well, I believe that's true because I know that you pay one application fee for a 12-month period. Yeah. So that should hold true.
Yeah.
Okay. It seems like that's all of the questions that have come through. And I, on behalf of all of us. I appreciate your time coming this morning. We'll be sending out the recording, and we see this as the beginning of the conversation. So as other questions come up, or if you have very specific questions that you didn't want to share with the whole group, feel free to reach out to us and we'll do our best to answer them and hopefully help you decide if this is the right program for you. But thank you very much.
Yes, thank you. Have a good day.
Thank you.
Thank you. Bye.